Hi, my name's Lucy. This is my presentation on diabetes insipidus. So some symptoms and clinical manifestations are nocturia, so you're waking up in the middle of the night to go to the bathroom, hypernatremia, the increased sodium, polyuria, large amounts frequently going to the bathroom, polydipsia, excessive thirst, severe dehydration, and also low urine specific gravity, and the specific gravity is usually closer to 1. So one of the diagnostic tests techniques that they use for diabetes insipidus is the water deprivation test. So they measure the ability of the kidneys to concentrate the urine through the influence of the antidiuretic hormone. And so how they do this is for 8 hours or till 5% of the body mass is lost, the patient is not allowed to have any fluids. And through these 8 hours, they monitor the patient's weight and the plasma osmolality hourly. And urine volume and osmolality is also measured every 2 hours. And so after that 8-hour period of not being able to take in any fluids, they give you 2 micrograms of desmopressin, which we, in the treatments, we'll learn a little bit more about. Desmopressin is administered over the next 4 hours, and then the urine and plasma osmolality once again is measured. So some ranges: if serum osmolality is over 305 osmoles, I believe, this means that the patient has diabetes insipidus, and the test is then terminated. Also for urine osmolality, so for nephrogenic diabetes insipidus, if it is before and after the desmopressin, the urine osmolality is under 300 osmoles, and then central diabetes insipidus, before the desmopressin is administered, the urine osmolality is below 300 osmoles, and then after rises to 800 osmoles. And then a normal range for someone who doesn't have diabetes insipidus, the urine osmolality should be between 500 to 850 osmoles, and then serum osmolality should be between 285 and 295 osmoles. And then some other diagnostic techniques for for diabetes insipidus is an MRI scan or magnetic resonance imaging, so detecting any abnormalities inside the pituitary gland or near the pituitary gland using a strong magnetic field, and that is more for central diabetes insipidus because that has to do with the hypothalamus of the posterior pituitary. And then also genetic screening can be used in your family if someone has similar issues. This can see if there's any mutations within the genes that is responsible for causing the disease. And then some treatments. So for central diabetes insipidus, they give desmopressin, which basically is kind of helping replenish the ADH or vasopressin levels in your body because there's decreased levels, so it's kind of I guess you could say a synthetic form of ADH. And it helps in control of when one has increased thirst and lots of urination as a result, and can also help prevent dehydration. So for nephrogenic diabetes insipidus, there isn't an exact treatment that can directly address the problem, but some of the first lines of treatment that they'll first use for nephrogenic diabetes insipidus. So one of them is hydrochlorothiazide, and this doesn't work for everyone, but it can be prescribed to help improve the symptoms. And in those, it does help. It can help decrease the urine output. And then amyloid as well, as we saw under the causes for nephrogenic lithium toxicity can be an issue. So amyloid blocks the entry of lithium through sodium channels. And then also for nephrogenic diabetes insipidus, what they can use as a treatment plan is a low sodium and a low protein diet. And this can help decrease the amount of polyuria or increase thirst. And I believe it could also decrease the amount of urine because you're not drinking as much. And this helps keeps the sodium levels in your kidneys balanced and remove more water from the kidneys and overall increase the kidney function, especially since you are excreting so much water in your urine. And then also intake of water is important to help prevent any dehydration. And then here are my sources. And then I know this is online, so technically nobody can ask questions, but I included this at the end just because. So yeah, but that's my presentation. Hope everybody is staying safe and healthy, and yeah, bye.